everybody. Good evening. I'm Dr. Anu Bajaj, and we are here for our next episode of No Spin Live with Dr. Christine Hamori and Dr. Jason Pozner. So hi, everybody.
Hi.
We're going to talk about this great article that we all read, but first I'm going to let both Dr. Hamori and Dr. Pozner tell us where they are and what's been going on in their neck of the woods.
Sure. I'll start because I'm working. I'm in Boca Raton, Florida. Florida. And we've been back to work this is our 5th week back. And we went through the same doing nothing for 6 weeks, except tuning up the office a little bit and pictures and painting and things. But we've been back to work and there's been a lot of demand. But I've been talking to my friends like Christine all over the world and different cities in the US. And it's really interesting to hear, like, you're still on lockdown and we're like out and about.
It's really crazy. So here in Massachusetts, I'm in the Boston area. Everyone's with masks. We still are in what's called phase 1. So we don't have any restaurants open except for takeout. They just opened hair salons this past Monday. We can't operate unless it's still emergency. So it's really crazy and difficult. They're very vague about med spas. They said day spas can't start until phase 3, but physicians can start seeing patients next week, quote. So we're just kind of sliding in under those rules, trying to do some Botox, but can't do elective surgery. Hopefully in a couple weeks we can do it. But everyone's with a mask, even if you're out and about. The grocery store, there's lines on the floor, which way to go. Still locked down.
Oklahoma is kind of in the middle. We're in phase 3 now. Like when you go to Whole Foods, you kind of have to wear a mask. And like you said, they have the spaces where you can stand in line. But we've been operating since May 1st. And it's interesting because, you know, if for our office, we require that patients come in with a mask, and some do and some don't. Obviously, nobody's waiting in the waiting room anymore. We've got that streamlined, so they go directly to an exam room. So try to minimize any contact, but we'll see how it goes. It's kind of interesting.
But the demand's there. There's a lot of phone calls. We have surgery that wants to be booked. It's amazing. People kind of feel pent up. But I think with plastic surgery is they're looking at themselves. Maybe they gained a little weight and they want to get something done because they figure there's no downtime. They love that you can get filler around your mouth and wear a mask to hide the bruising. It's crazy.
And then most of them are still working from home, so they don't have to go back to the office yet. So their recovery, the way they're looking at it is it's easier to do a recovery without taking additional time off of work.
You know, it's a lot of lipos. It's amazing how much lipo we're doing now. The COVID-19 is really the COVID-19.
Oh, that's interesting.
I like that.
Yeah, they say you're coming out of this. They're saying you're coming out of this a hunk, a chunk, or a drunk, or a combination of those.
So with that segue, we'll go into our article. So what did you guys think of the article about Chrissy Teigen getting her implants removed?
Well, I think she made the little statement that she has had them for a while, and I guess it all came up because she got tested for COVID and was explaining why she got tested, that she's decided to take her implants that's been in, I think, for 20 years out, and they seem to have served her well. But the question is, what happens when you take the breast implants out? It's not just like, oh, it's the perfect thing. I've had 20 years of nice sized breast implants and now I'm done with them, take them out. It's just, you got to wonder what's going to happen to the stretched out skin. And, you can take it either way. Is it a positive thing? Is it a negative thing? Are you going to need a lift? It's a stressful thing, but she's trying to put a happy kind of tilt on it, I think.
I got like 2 words to tell you guys.
What?
Like 2 words. Like, who cares?
Right.
like why would
She's
I care about
followers?
Well, like, why do I care about Chrissy Teigen's implants? I mean, nobody cares, But like, as we talked a little bit about just prior to the call, I mean, this is pretty much a normal day in a plastic surgery practice that does these type of procedures. People get them in, people get them out. People went through menopause and gained 30 pounds, and now they look fat with their big implants in.
Right.
And they want to take them out and do fat grafting or something. But there's a lot of options available for the modern woman who either is thinking about implants or had them for a while and is no longer happy because they don't maybe fit her frame anymore, or maybe she thinks she looks a little heavy with them. So there's a lot of options available. So like, I just don't like it when someone takes their ideal and what they're doing and pushes it on everybody else. There's a lot of different men and women come in a lot of different shapes and sizes. I just care that people are healthy and they exercise and they stay fit, and and if they have questions about their breast implants or something, come to a board certified plastic surgeon, someone who is respectable, who's not like posting on Instagram dancing around the operating room table. Like
Right.
Go to somebody real who's serious and can answer your questions.
I would
you
have
develop a rapport with.
Yeah,
I
no,
agree.
that makes sense. And it's true. I think we go through different phases of our lives. And at one point in our lives, we may want implants. At another point, a woman may decide she doesn't need them anymore.
Right.
And there
Right.
shouldn't be any stigma or judgment either way.
Yeah.
Just, I mean, as plastic surgeons, we're about helping people to feel better about themselves so that they can take care of any little thing that bothers them and give them some more confidence in how they approach the world.
Like how
Yeah,
many
she
times
mentioned
have-
her shirts, like she couldn't button her shirts, like one of the
Yeah.
reasons she's doing, 'cause she's
Get new
busting out.
shirts.
But maybe what you said, Jason, because she's like a little older, gaining weight, had
Yeah.
babies.
Well, maybe she just get new shirts.
Okay.
Yeah. But
Yes.
you know, and the question is, how many women do you see that after childbirth, some gain size
Yeah.
or menopause gain size, and other ones, like I saw one today post-op that I did a couple of weeks ago, and she looked amazing. I did a lift with implants and some mesh in her, but she was pancakes. I mean, she had 2 kids and just lost everything,
Oh,
and these just fit her frame. And she was like, I said, you look 20 years younger, and she was in her she really looked mid-20s, and she was in her later 30s. But it was a good operation for her. It took her back to where she was pre-pregnancy, and she said I was a double D prior to pregnancy, and I even got bigger with kids, and now she was down like a B cup.
wow.
So I put her in a solid D, and she looked like literally really great.
From the Plastic Surgery Channel, and please go to our website and check out more of our amazing videos and content.